hear one of our customers, Essex, talk about their experiences. My name's Adam Spur. I look after the business applications and the dynamics practice here at ANS. So you can see the slides. Just make sure you can see them moving, Emily. All good? So it's not a complicated agenda for the day. I thought we'd just have a little bit about ANS and the contact tracing and where we are today. And then Paul and I are going to have a chat. First of all, I put fireside chat, but then that was way too American for me, so I just changed it to chat. I'm going to ask Paul a few questions that we've put together that hopefully brings out their experience and what they've been doing with contact tracing, test and trace, etc. And then actually what I thought we'd do is, if we have some time, is we could get some questions going if we have some time. But what I can do is, if you see the chat, if you raise your hand or ask a question there, there's a few ANS people on the call as well, and they'll be happy to try and answer the questions as we go. Is that all right for everybody? Nodding.
Yeah, that's fine. Yeah,
we're all good, and you can see the agenda. There we go. Okay, so I'm going to spend 1 minute talking literally about ANS. For those who don't know us already, there's plenty of information on the website that you should go and check out. But just if I gave you 3 or 4 points, which is, we're a 300-person company, founded in 1996, so we've been around quite a long time and going through evolutions of IT with that. We've got a 50-50 split of private sector organisations and public sector organisations. We work with about just over 40 local authorities now as customers. And one of the things that is important to us this year is we're proud that we are Microsoft Partner of the Year this year. So I'm not going to dwell too long on the ANS. What we do, though, is these 3 things, if you have them in your mind. So we basically help people get into the cloud, be that migrations, data center zero, connectivity. Then we help them with their business applications, and that's the Power Platform, Dynamics, local government specific solutions. And then we're keen on data. Everybody's keen on data right now. AI, BI, platforms, machine learning, data literacy, augmented analytics, data analytics, and helping people get value out of the data. So those are the 3 things that generally ANS focus on. And what we're going to talk about today, that's a building slide. What we're going to talk about today is where we're up to with our local authority customers and contact tracing. So I just wanted to set the scene for how we get to where we are. So back in March 2020, we started getting involved with some of our customers who asked us to build some of these low-code, no-code power apps to fill a problem that they had. So we started off building vulnerable citizens apps so that they could safely deliver medicine and food packages to the vulnerable. And we deployed 25 or so of those around in councils. And then we started getting involved with a PPE app as well. So people were struggling to understand which people had the PPE and which people didn't, and where they were in the supply chain to get it to the front line as well. And then we moved forward onto that by also then starting talking about which people on the front line are at work and which ones aren't, and what's the status of them. And that led us on to a conversation with one of our good customers, GMCA, the Combined Authority in Greater Manchester, who look after the 10 authorities there. And they were really early out of the blocks, and they said, we've got a problem coming with outbreak management, and we need to have a solution for it very quickly because it's coming our way. So they started building on Dynamics an application via the customer service part of Dynamics in order to build a contact tracing system. What subsequently happened is Microsoft were thinking about the same thing, and they were working with 11 of the beacon councils in order to figure out what they were going to do around contact tracing. And they developed this proof of concept. Then Microsoft asked a number of the partners, ANS included, to develop that proof of concept into a solution that could be deployed in the councils. So basically then we came up with a solution that we committed to give the first 40 for free to local authorities for councils who wanted to deploy a contact tracing application. It comes straight out of the box and it starts working, which is what Paul has kindly agreed to talk about. Then what happened, obviously, subsequent to the first iteration, with our knowledge of what happened at Essex and with GMCA and Bury and Oldham and Trafford and all those others, we then put in the second iteration of the solution, which is where we are today. So the objective of today is purely for me to ask Paul a few questions about their experiences and what they've done and how they've done it, in order to give some of our other customers and people who we're talking to a flavour of what's been possible with working together and trying to do our best to help the people who have got some symptoms, or they're in locations, or they're in a locality, or we need to triage their case and then take some action against it. So any questions before I start having a chat with Paul? Is everybody good? It's not supposed to be me presenting this and Paul. So everybody all right with that? Quick overview of ANS, and then a quick understanding of, we started off with building some apps, and we've ended up deploying our contact tracing in 25 plus councils now. Okay, so Paul, I was going to introduce you, but I'm sure you can do a much better job of that. So if you could just tell me, a little bit about Essex, what you do there, your role.
Sure. Yeah. So my name is Paul Aldred. I work for technology services within Essex County Council. My day job is as a business partner, so I sit between technology services and our place and public health area. And my involvement around this project is entirely due to the relationships that I've got into public health and kind of bringing those areas together. In terms of Essex County Council, we have a fairly complex local council structure within Essex. So we have the county council, we have 2 unitary authorities, and we also have 14 districts that make up the whole of Essex. So when we were faced with setting up a test and trace service, obviously we needed to kind of look across the whole patch to understand how we were going to do that. And I think you can see probably by trying to corral that many organisations, it was always going to be an interesting job.
So you just explain that structure for us, will you? Because it is quite complicated, isn't it?
Yeah, I mean, I guess for those people that are kind of in county council authorities, it will be something that's reasonably familiar. It's just that the number of districts we have is quite large by comparison to other areas. So 14 districts plus 2 unitary authorities in Southend, obviously right out on the coast, and also Thurrock, who border the kind of London boroughs as well, right down there with Lakeside and by the Dartford Bridge and that kind of stuff. And kind of fairly early on, once we understood that we needed to set up the test and trace service, it was then a case of actually trying to understand how we could coordinate that across Essex. And typically, Southend and Thurrock, being unitary authorities, would tend to kind of go their own way on this type of initiative, which Thurrock did, and they've put their own solution in place. Southend, I think because of the links between the 2 directors of public health, actually came together with Essex County Council, kind of seeing the sense that actually the geographical borders are pretty senseless as far as the test and trace service are concerned. So actually, we know we're going to have borders with our neighbouring counties, but trying to minimise that within Essex seemed to make an awful lot of sense. So that's kind of how we move forward.
So just so before you even started thinking about this solution, there must have been an awful lot of internal alignment needed, because we're having a lot of conversations and people are thinking, do we come together? Do we do it separately? How are we all going to help as a region? So you must have done a lot of work internally to start with.
Yeah, and I think that a lot of this is around kind of leveraging relationships that were probably already in place. So I've talked about the directors of public health. Obviously, from a county perspective, we have a lot of links through public health down to environmental health officers and so on in the districts. Key relationships as well that we needed to or key resources we need to put in place early on with so many different organisations involved was around information governance, because we knew that actually we just would not be able to progress without having the right agreements in place. So we already have kind of cross Essex information governance forums that came together very, very quickly to define and resolve the information governance issues. So having agreements in place, having contracts in place, setting up the agreement with Public Health England, all things that are needed to be done to set up the test and trace service rather than the technology element of it. And they were kicked off very, very quickly. The other part for us as well is that within the county council, because of the kind of commissioning-led approach that we moved to some years ago, we don't generally have the ability to be able to instigate new operational teams really quickly. And we've worked with an NHS partner called Provide, who run our wellbeing service. We brought them in to run the shielding service, literally at the point that we were going into lockdown. That was set up really quickly. And so it made sense that actually we'd partner with them again for them to actually operate the test and trace service. So they're actually the core partner as far as test and trace is concerned. They are the people that run the service on behalf of Essex County Council and
so I've got an interesting question on them later. So in terms of because obviously we're doing lots of calls with lots of people, and for you, who were the main stakeholders? Who were the driving forces of getting this done as quickly as you've done it? Because then there needs to be some people who are beating that drum.
Yeah, absolutely. So public health clearly are the root of that. So public health within Essex County Council and within Southend, and we had a really very, very clear remit from them, and really strong backing and decision making from their perspective as well to be able to take us through. So I think that was the root of it. They set the scene for everybody else that kind of came in, which brought in information governance, as we've spoken about. It brought in procurement people because we needed to get that off the ground really, really quickly. Technology services, obviously, from my perspective, we needed to come in. Provide, we needed to get them on board as they were going to operate it, but also then actually ensuring that we've got clear routes through to the districts and also to the third sector as well, because we use voluntary organisations quite heavily as subject matter experts in areas such as homelessness and so on, where we know, we may need to trace through those areas as well. And having those relationships clear and in place and people bought into it from the outset was very, very important for us.
So if you hadn't have aligned all those people together or got a very clear steer from public health, what do you think would have happened? Would you think it would have been spinning around and around?
Yeah, without doubt. So I think that because of that clear steer, we were able to actually move forward very quickly in setting up the service itself. So the service setup was probably 2 to 3 weeks in advance of the IT service setup. So they started around sort of 2 to 3 weeks before the tech side came in. And that actually gave us a really clear, straightforward route through because we knew what we needed to do. And the remit was basically once they'd got to that point, they knew the shape of the service, they knew who was involved, and our remit was then, let's get an IT service that actually meets the needs, but it needs to be in extremely quickly, because we're expecting the number of outbreaks across Essex. There's a serious risk there that actually they may increase rapidly. And so we need something in place to be able to manage them and reduce the level of risk of running a manual service.
Yeah.
In the event,
was that Excel spreadsheets, post-it notes, emails flying around?
Absolutely, all of those things, all of those normal office things that you do to try and plug the gaps. And that was fine in the first couple of weeks, and it was only 2 weeks that they were without a system for. We didn't see a rapid escalation at that point in time. We had one major outbreak and a number of smaller ones, which were able to be dealt with in those first couple of weeks.
So I'm going to ask you a little bit about call volumes in a bit, because it's a question we get asked all the time.
Yep.
Are you getting inquiries, or are the outbreaks, or are there things you have to do? So I'm going to ask you that in a little while. But if you could just, for the audience today, just sort of have a wander through the process that you're seeing at Essex. So where does the inquiry start from, and then sort of what happens now that you're starting you've got an IT system that's looking after some of the things as well?
Yeah, sure. So initially, Public Health England stated that we would be receiving interface files from them on a regular basis because of the volume of cases they were expecting to have to report to us. Up to this point in time, we haven't seen that. So at the moment, we're receiving emails from Public Health England, which are relatively low volume. They come into our partner Provide. Provide actually do the kind of data upload. They enter that data into the track and trace system. They go through a triage process, which I think will probably really come into its own if we do face, really significant call volumes and interface files and so on. At which point they make a determination about the severity of the case, how many people, the types of people they need to get involved, and so on. And that could be kind of public health professionals that they need to bring in to do the initial consultation with the location of the outbreaks. It could be a care home, it could be a restaurant, it could be an office space, and also with the individual that's been identified as the cause of the outbreak or the centre of the outbreak. Once they've worked out actually who may have come into contact with that person, then it could be that we involve the environmental health officers if we need boots on the ground in a local area, so that's our link into the districts, or it could be that actually we then use some kind of lesser qualified people within Provide to actually just do the phone calls, do the hard miles of actually phoning those people that may actually have come into contact with the original case. So those are all handled through allocations within the system, literally allocating jobs out to people so that they are able to pick those things up and then work them through. And I think that's kind of where we're at the moment. Provider are kind of doing the same thing for both ourselves and Southend, so there's no real difference as far as that's concerned. And we're also kind of looking to provide business intelligence information out of the system, which will then kind of help keep them up to date with where the cases are, what the sort of throughput is, whether there are any particular cases that are causing problems, so that they can kind of focus additional resource. So to kind of take the case management bit to and increase their effectiveness of using the system as well. So that's where we're at, really. Cool.
So Graham, I'll come to your question in a minute, if I may, about are you receiving, where are you receiving them from Public Health England? I think the questions I get asked quite a lot, Paul, are around, well, what about security then? What about information governance? How have you managed to do this?
Yeah, sure. So one of the key things for the implementation for us, and we originally saw the Microsoft demo, and then off the back of that, quickly arranged a time with ANS to the ANS demo as one of the resellers. We involved kind of all of the public health people. We involved Provide, who were going to be principal users. We involved information governance, procurement. Everybody we could get, we kind of threw onto those calls so that we were all able to see it. And it was very clear from the outset that actually it did about 80% of what we needed it to do, with probably a few minor tweaks. The real seller from a tech services perspective was also the fact that actually it sits on the Microsoft 365 platform, so it's within Dynamics. But actually being within MS365, it's also going to adhere to all of the security policies that we already have in place that govern that platform. Now, we didn't have Dynamics in place before this. Dynamics isn't something that was in our roadmap at all, but it's something which we were able to implement in a really short space of time. So we went live literally 1 month to the day after we saw the ANS demo, and that was a fully secure implementation because it sits on the MS365 platform, and our security architects, our solution architects, technology solution architects, were all really familiar with the things that they needed to do and to test and to prove were in place. So it was a very, very significant benefit for us.
Yeah, I don't think we'd have moved quite as fast if we hadn't ticked those boxes very early on, because they were the ones that had lots of different questions about security. Absolutely. And information, right?
And I think, Adam, as well, I think the fact that we're talking about bringing people in who are not within Essex County Council to an ECC hosted service, and yet actually all of the same security policies are in place across all of those organisations. That in years gone by would have just been an absolute headache to have achieved. So yeah, worked really well. So
then just talk about your provider. We were chatting about it yesterday. They seem to have picked up the baton really well, your third party provider, haven't they? Are they now, they're helping you with the training, or are they doing the training?
Yeah, absolutely. So from the early days, even including the ANS demo that you guys provided, Provide were actually in there as one of the partners. So both from a business perspective, the people that are actually going to be operating the service, and also their technology team as well, to ensure that actually we knew what we were getting into, both from us hosting it and them actually needing to get in there and use it pretty quickly. So from that point, they were involved in all of the workshops that we did with ANS. We held workshops that were outside of the ANS sessions, just internally between us, so that we could prove out the stuff that we did with you guys, prove it worked, go through business processes between us, make sure that actually we understood how it was going to work, tweak it where we needed to, all of those sorts of things. So by the time we went live, Provide actually now effectively are kind of custodians of the system. So whilst it's still hosted by ECC, the content, the thing it does, the look and feel of it, the data that it's capturing, the workflows that are in there, all of those things actually have really been either tweaked or instantiated by Provide, so that they own those things. When we went live, it was with Provide only to start with. So it's one of those things where you want to bite off as much as you can chew rather than trying to throw too much in. Definitely minimum viable product rather than going for a complete solution. So day one, Provide trained their own staff. Those staff are now the super users and are training other staff within Provide. They've trained staff within Southend, and they'll be doing the training for each of the districts as it moves out.
So it's sort of gone out and out.
Absolutely, yeah.
You found that you got some super users initially, and then you've used those to train the rest of the people as it gets bigger and bigger.
Absolutely, and part of that is down to actually how simple Dynamics is. There's huge crossover, obviously, with other Microsoft applications, the way it looks, the way it feels, operates, all of those sorts of things. And also the processes that are in there, the business processes to support test and trace, are relatively straightforward. And so actually doing train the trainer and getting each of the groups to kind of push it out is a really effective way of being able to propagate this thing really quickly, rather than it being a kind of a centralised mechanism.
So just I'm going to wrap in Graham's question now. So you
Sure.
know, what were the main challenges that you faced, and then if you could touch on also, you know, our PPE sending through only the cases that they haven't been able to contact themselves, because I know when we spoke, one of the challenges was the information that you were receiving and how you married that across the region.
Yeah. So if we do the Public Health England bit first, the initial ask was for us to pick up outbreaks within Essex, which they believed would be about 20% of the overall number of cases within the geographical area. So Public Health England were in theory going to be contacting people who, you know, had directly been identified as being affected, not an outbreak, just an individual, and they were going to be sending through outbreaks that may have happened in a care home or in a workplace, that kind of thing. And that's the majority of what we're getting through. I believe we are seeing some cases come through where Public Health England have struggled to contact individuals, but the majority of our work is still based around outbreaks, so larger outbreaks, of which we've actually had relatively few within Essex. I think if we look at, so one of the worries that we had about that was actually in how do you effectively monitor outbreaks across the region if you're only seeing 20% of the data? So that was one of the really big concerns we had. And Public Health England actually now provide us with, I think what they call the postcode data.
Yeah.
But actually we see data at a more detailed level than that because of the agreement that we have in place. And we can marry that with the data that's actually in Dynamics using Power BI to bring the two things together. And that's something that we're actively looking at right now. We're putting that in place to actually be able to identify where outbreaks are occurring, how they're spreading, where the linkages are, all of which is information we're capturing within Dynamics as well. In terms of kind of major challenges, without doubt, the biggest challenge was actually the speed with which we needed to get this thing implemented. So I think the overall test and trace system was live within about 3 weeks, I think. So that's the service itself. That's having a phone line, taking calls, taking emails, and being able to actually get out there and contact people. And the IT system was about 2 weeks after that. So speed was without doubt the biggest challenge, and we were really conscious of the kind of risks that we were running if we didn't get the service in place and then didn't get the IT system in place before we saw any increase in cases across Essex. So
yeah.
A lot of our decision making was based against the risk actually to public health, and we kind of moderated around the decision making within the county council based on that as well. The other bits I think we talked about already, having the best part of 20 organisations involved in this is, you know, a pretty substantial undertaking to bring them all together, and the information governance piece across that, and particularly working with public health. I think those are the biggest areas that we had, to be honest with you.
So final question from me. We're bang on past now. Final question from me is top three lessons learned or tips for the audience as a leave behind. If they're going to write down 3 things, Paul, from listening to you, what do you think those 3 things would be? Okay, so I think the first one is absolute clarity about what you're trying to deliver. So real focus on that. And everything else kind of flows out of that. I think collaboration, leveraging those relationships that you already have in place is critical, and that includes the information governance side of things. And I think from a technology perspective, it's then being realistic about what you can deliver in the timescale that you've got. So make sure that you don't take 2 months, 3 months to deliver something that's fully featured when actually 80% of what you need
can be delivered in actually a really short space of time. And what we found with that particularly was that once we'd gone live, Provide started using it, and understandably, their thinking changed slightly. We needed to tweak a few bits that to really embed the system within the service. And that would have happened regardless of whether or not we'd taken 4 weeks or 8 weeks to actually get that stuff in there. So I think those three things would be.
So am I summarising in terms of it does 80% of the things that you wanted it to do? So you took a decision to get on with it.
Absolutely.
And then tweak it as you went along to your needs afterwards. And how much tweaking have you actually done realistically?
So we have tweaked it since we went live with it. So what I would say is that the demo that we saw from you guys was probably about 75% of what we implemented. Through the workshops we had with you, we changed some things, which was a lot of wording. I think some of the kind of service element areas of what the test and trace service needed to do had actually already moved forward by that point in time.
Yeah.
And that would have been common across us and across Manchester and so on. So we accommodated those things, but we're very focused on, does this need to be delivered for day one? And if it didn't, let's push it back so that we don't get distracted. Since day one, we've made some tweaks to kind of standardize some of the labels and wording to make sure that as we roll out to a much broader audience, a much broader range of organizations, that actually it's not confusing or people don't stumble over things, so that everything is absolutely as it should be. And we've made some functional changes as well. There's a bit of process change. There's some information that we weren't capturing that we needed to capture, some bits like that, but it's not been significant so far. We took a decision early on not to include some bits like email integration, just purely because we knew that actually that was going to require us to do more security work, more design work. There would be more red tape around that. More kind of due diligence, if you like, and it wasn't required for day one. We would have a service that was there and working for Provide on day one without that stuff. So those things are coming along now. Integration with our in-house BI is happening now. We've currently got Essex, Provide and Southend using the system, and we are now onboarding the districts as well, so that actually over the next 2 to 3 weeks we should then have kind of a full stable rollout.
Cool. So a couple of questions then as we sort of move on. So
sure.
Kat's asking you a question. Do you make the tweaks yourself within the council, or does ANS need to do that? Okay,
so there's definitely two options there. Most of the form configuration changes can be done in-house if you have the resource. Now, Dynamics isn't something that we have in-house. It's not part of our strategic direction, so we're not planning to become experts in that side of things. So we actually agreed with ANS early on a pot of days to actually get them to make those tweaks for us. And I think so far, I think we put in 50 days to start with, and I think we've used maybe 20%
50 hours.
of that.
I wish you had put in 50
Sorry,
days. 50
hours, I beg your pardon.
We're doing this fast, Paul.
Yeah, and have we used maybe 20% of those?
Yeah, I don't think you've used very much.
No.
I think your account manager's about to say, "What do you need? Can we do anything else for you?" So he's probably on the call now. So question from Graham then: are you feeding back data into the national test and trace system?
So that's definitely something that is on the cards, and it's part of the kind of next BI piece that we're going to be doing. So I think at the moment the information is being kind of managed manually by the BI team, and we're hooking up Power BI literally this week to start doing that testing. So I would say within the next week, probably by the end of next week, then they should have that facility there to be able to do that.
We've seen with other people though that's a little bit of a moving feast. So trying to automate it, you automate it on one day, and it may have moved a little by day 2 and 3.
Yeah.
Is that happening to you as well? Or is it fairly static now?
Well, so I think certainly in terms of data that we're seeing coming into us from Public Health England, it's been relatively static actually for the past week.
Yeah.
So that's meant that the analysis that the BI guys are doing has been kind of more about doing the analysis rather than managing the data.
Yeah,
and we're kind of anticipating data going back being similar to that. Certainly in the early days, I would imagine that we're going to be providing, from a tech services perspective, we're going to be providing the platform to our business intelligence teams to be able to extract data and then push it out to Public Health England. We're then going to need to look at actually how we automate that, but I wouldn't imagine that that's going to be within the next couple of weeks. I think it will take longer than that for it to settle down.
And then last question then from John. Did Essex have an IT solution related to their COVID community hub humanitarian response?
So I imagine that is the shielding service. So when we went into lockdown, we had no shielding service in place. We had the Essex Wellbeing Service, who fortunately we were actually at a point with that where we were about to go live with a particular IT system and the service through Provide, our NHS partner that actually operates that service, which allowed us to kind of tweak the use of that system so that it actually became a shielding service.
Yeah, right.
And we worked really hard with them for probably 2 to 3 weeks to actually reshape that service.
And are you planning on linking the service with Test and Trace?
At this point in time, not in terms of the two operational services, but I suspect we may well do from a BI perspective. So
from Emily, are you using this for community outbreaks that are not linked to settings? So I don't know the answer to that. As to whether, that's the first one that's made you think.
So thank you, Emily. I don't know whether we've actually received any of those, to be honest with you. But the answer is yes, we would. So if we get any of those through, yes, we would. In fact, we would be quite happy, I think, for Public Health England just to actually send us all of the cases they're aware of in Essex, so we can pick up the Test and Trace service across the geographic region. To us, that would make much more sense, I think.
Don't let Matt Hancock hear you say that, will you? he's busy. Yeah, well.
Absolutely.
Okay, Emily, have you got another question? Or
yeah, I was just going to comment that so I'm Emily. I'm from Staffordshire County, so we have similar challenges with multiple districts and boroughs as part of our county. And our biggest challenge at the moment is community outbreaks, where there is no commonly linked setting, and trying to manage and contact trace individuals to then make a connection to a particular gathering, or it's private gatherings that have been our challenge. So birthday parties, after wedding celebrations, and identifying them. So I was just that's sort of what my question was around, was how this system, whether this system would support that type of contact tracing.
Yeah, it definitely does. It's flexible enough to be able to do that. So there are basically 3 tiers within the system. So the top tier is actually the case itself, and that case can have a locality, and it can have the contact who's been identified as being the source of that outbreak. Both of those things are very flexible. So the locality can be anything you want it to be, and obviously the person you need to register anyway. From there, so those, I guess, are the first 2 tiers. The third tier are then actually the individuals that actually have been in contact with that person who's identified as the centre of the outbreak. So you then have all of those people that are registered on the system, and you can go in and look at an individual. Okay, so let's say it's one of the people that's been identified as a secondary contact. If that person has been identified as a secondary contact in multiple cases, the system will tell you that, just purely because there's a link there that said, yep, there's that person, and they're on a case that's occurred in a care home and a case that's occurred as a result of a private party or a private gathering in somebody's house. So because it links the data together, actually you can see how people and cases may be related. And I think it's a really simple setup, actually. It's a really simple data structure, but that's the power of it, because it actually links all of the cases together by the people who are involved, and that immediately, for either directly being able to see in the system that that person's been involved in 2 cases, 3 cases, or through business intelligence to be able to see kind of a geographic spread as well, knowing where those people are located, actually could really help.
Thank you, Paul.
So thanks, Paul. Thanks, Emily, for your question. Great question. I think we've run out of time now in terms of the time that we said it was going to be. Paul, million thanks to you. I'm sure that everybody else on the call as well found that incredibly informative and very, very useful. Very, very useful information. Obviously, if you'd like to see a demo of the stuff that Paul's been talking about and the system that Essex have deployed, your ANS account manager will be happy to do that. I think also what we're going to do is follow up with an email with a link to the recording of the call. So if you wanted to share it around, then that's cool as well. If there's some questions that we haven't got to, and I see there's a couple, one from you, Emily, I do apologise. Let's reach back out to you as well and make sure that we've covered all of your questions. But just for now, from ANS, thank you all for joining us. Hope that's been really useful. Massive thanks to Paul, and carry on using those hours, Paul. All right, I'll leave it there. Many thanks. Have a great rest of your day.
Cheers. Thank you both. Thank you.
Thanks a lot.
Yeah.
Take
Bye-bye.
care.
Thanks, Paul. Cheers.